Hi friends, I'm Priya Mistry, the TMJ doc. This video is about dental work and TMJ disorders. So I see many of you guys on Facebook support groups, on Instagram, on social media, talking about how you're preparing for or anticipating or kind of dreading an upcoming dental appointment because you have TMJ issues and you're worried that this dental appointment is going to make those issues worse. So that inspired me to make this video to give you guys some good tips and tricks on how to get through a dental appointment while still having a TMJ disorder. So watch this video until the end if you want to know how to do that, how to work with your dentist and hygienist to make sure that your TMJD symptoms are not exacerbated by dental work. For those of you who don't know me, I'm Priya Mistry. I'm a general dentist with a practice in Portland, Oregon. At my practice, we are dedicated to taking care of patients with TMJ disorders. I work here with my wonderful mentor, Dr. Arthur L. Parker. If you don't already, please be sure to follow me on Instagram. Check out my Instagram handle. I do post here quite frequently, so there's lots of tips, tricks, trivia, lots of information essentially on TMJ disorders. So if you like to geek out on that stuff like I do, be sure to check out my Instagram. So let's get right into it. So TMJ disorders can be debilitating. I see it every single day. I've been practicing exclusively TMJ work for about 2.5 years now, but before that, I did general dentistry for a good 11 years. So in those 11 years, I remember countless occasions where I would literally put my tunnel vision on, I would get to work, and I would try to finish each procedure as efficiently as possible, even if that meant that my poor patient had to stay open for long periods of time without breaks. Those patients without TMJD could handle those appointments, but I've come to realize more recently that those patients with TMJD most likely kind of suffered through those appointments, feeling like they didn't have any other options. And so I'm here to tell you guys that that is not the case. You have options. So what, you ask, can be done? First and foremost, be sure to inform your dentist and your hygienist that you have TMJ problems. Do not say, I have TMJ. TMJ is not a diagnosis. All TMJ means is temporomandibular joints. Additionally, the phrase, I have TMJ, can really mean a number of things. It can mean that you have clicking or popping in the joints. It can mean that your jaw locks up. It can mean you have headaches. It can mean you have jaw pain, ear pain, neck pain, any combination of those things. So really saying I have TMJ is just not specific enough. Oftentimes, unfortunately, when a dentist hears the words, I have TMJ, their usual knee-jerk reaction in their minds is this patient is high maintenance, when that's usually not the case. So instead of saying I have TMJ, tell your dentist, tell your hygienist, I have a TMJ disorder, and be specific. What does that mean? Tell them specific symptoms. Tell them your jaw clicks or it pops. Tell them it hurts to stay open for long periods of time. Tell them your jaw hurts, you have headaches. Tell them exactly what's going on. Then go on to say that you would really appreciate breaks during your appointments, where you can close your jaw, where you can massage your jaw muscles. And if it's possible, ask if you can have a longer appointment. That way the dentist isn't feeling rushed. You get the breaks that you need to close your mouth, to massage your jaw muscles. So some dentists will charge for this additional time, others will not. But most importantly, communicate with your dentist and your hygienist. So when the day of the dental appointment comes, put a sticker on your forehead. Why, you ask? A sticker on your forehead is a visual cue to the dentist to remind them that you need a break. So like I mentioned before, all of us dentists are so used to focusing on one little tooth or two little teeth in a quadrant in your mouth. So really, tunnel vision is a real thing with us. The loops that we wear just magnify everything and put us more into that tunnel vision. So that sticker on your forehead, on your cheek, wherever it may be, on the tip of your nose, is a visual cue to remind the dentist to give you breaks. That way you don't always have to feel like you're asking or that you're bothering the dentist by asking. There's a visual cue to make sure that you guys are all on the same page. And remember not to be shy. You can raise your hand and ask for a break if you need one. Another thing that you may want to ask for is a smaller bite block. So a lot of us dentists use a little bite block or a bite rest, or some people call it a tooth pillow, in between your teeth to help you stay open. Most of us dentists have a pediatric size of that too. So ask for the pediatric size. That way your mouth doesn't have to be open larger than necessary. It'll put less strain on the muscles and less strain on your joints. So another thing to do is the muscle releases. I've made a bunch of videos on muscle releases in my playlist on this channel. I think the playlist is called TMJ exercises / muscle releases. So check out all those videos and do those muscle releases before and after your dental appointment when the anesthetic wears off, of course. Those muscle releases can be extremely beneficial in loosening up muscles and working out knots in tissue that's not very happy, essentially. So lastly, if you have a TMJ orthotic or a splint, wear it immediately after your dental visit. If made correctly, a TMJ orthotic puts the muscles of the head, neck, and jaw in a very relaxed position, and this helps to avoid discomfort or pain after a dental appointment. Do keep in mind that a TMJ orthotic is not the same thing as a dental night guard, and I go over this in detail in my video, Dental Night Guard or TMJ Orthotic, so be sure to check that out as well. Let's go over the list one last time. Number 1, communicate with your dentist and your hygienist about your TMJ disorder and be specific when you do so. Number 2, ask for frequent breaks every 5 minutes if necessary, and ask for a longer appointment time to accommodate those breaks. Number 3, wear a sticker on your forehead as a visual cue to the dentist to remember to give you breaks. Number 4, request the smallest bite block if they're going to use one at all. Number 5, do my muscle release exercises in my videos both before and after your dental appointment once the anesthetic wears off. And number 6, put your TMJ orthotic or splint in right after your dental appointment. So there you have it, my friends. I hope that this video helps you get through your next dental appointment successfully. If you have any questions, please ask them in the comment box below. Be sure to like, be sure to subscribe, do all the things, and remember, you can never have TMI about TMJ. Thank you.